Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and let's talk about habits and expansion. This is a very, very, very common question. You get a case, it's some type of kid or a teenager, and you're looking at the palate and you're like, shoot, one of two things. I can't just use Invisalign to tip the teeth, I need to do skeletal expansion. But the patient wants Invisalign and wants to get started like ASAP. How do I do both at the same time? Or B, you got a patient clearly has a tongue thrust, has some type of oral habit, thumb sucking, something like that, and patient refuses to do OMT, which is always my first choice, oral myofunctional therapy. If you don't know what that is, you'll want to check out all my videos and playlists on OMT. I have tons. You can search by keyword within my channel, OMT. Go to the little magnifying glass and type those words in. You can watch all my videos. It may also be on the homepage as a playlist. I'm not sure. But I'm quite sure. I do love to check out Invisalign's patents. That's one of the things I like to stalk because I like to see what they're up to. Not that I'm trying to compete with them because I'm not an aligner company. I'm not even interested. I've done that before. No thanks. I like to stalk because I like to see what they're going to come out with next. Like I knew about the MA years and years and years before they came out with the MA, right? I like to see what's in the funnel, see what's coming up, so that I know what to look forward to because I actually really like Invisalign's product. So I do know that it looks like they've got some type of expansion device. Now there is an expansion device that clips on aligners. The patent is owned by something called Sheep Medical, and it's a company in Japan, although they are rolling out to the US, but it is not FDA approved. I did talk to the CEO. It is not FDA approved for kids, and it's not FDA approved for skeletal expansion in kids. It is which is basically kind of ridiculous because it's the same darn thing. It is FDA approved for sleep, which, come on. So I've been begging and pleading with Sheep Medical to find a way to release their product, mixed dentition, to kids so we can use it with phase 1 aligners. So basically you're doing the aligners and you're clipping in like a palatal expander. It's not banded, it's gonna be removable, almost like the Schwartz, but no bow. I don't know exactly how it clips in, but I've seen some pictures. And I've had quite a few clients ask about it. They're the ones that brought it to me, and I called and contacted them. I'm like, hey, can we make this happen for phase 1? I can't wait any longer for Invisalign to hurry up and roll out this darn product. Shoot. If I could get this patent before Invisalign did, I would be rolling this out because it will go gangbusters. It will be so popular with pediatric dentists, orthodontists. I mean, what a pain to have to do first the expansion and then move on to the Invisalign. Why can't you do them simultaneously? And I've worked around it, but I mean, the problem is you got to be able to clip into the aligner somehow because constantly the dentition is changing, right? So there's no way you could fit a Schwartz. It would constantly be remolding, right? Unless there was a new one every time you changed an aligner or there was a way to clip it in. That's basically what I'm getting at. Anyways, so to answer your question, nope, can't do it same time. This is what I do with my doctors, obviously. We either do one of two things, and I don't know how much Invisalign loves this. By the way, Invisalign is making an appointment to talk to me next week. I always like to tell you guys what's going on because you know I don't work for them, nor have I ever taken any money from them. Actually, most of the time, they just give me a bunch of grief. I usually hear from their attorneys all the time. It's been a few years since I've heard from their attorneys saying that I said something wrong and they don't like it. But they'll be nice to me for like a day, and then they'll be nasty. But anyways, I don't really care. So what we do with our cases is one of two things. Either we're going to go ahead and do the expander first. I usually recommend fixed over removable because then we can do it fast, get it done, do the retention, hold for at least 2 or 3 months. Obviously, if you're trying to fix vertical, it's better to hold it for a little bit longer. But you can also fix vertical in the Invisalign, right? And then go ahead and rescan once the bite has settled and do the Invisalign. The other workaround, and I don't know how much Invisalign likes this, I'm going to tell them what I recommend because they could find a way to save plastic. And it always makes me feel bad when I do this other workaround because I feel like I'm throwing away a ton of plastic. And I know Invisalign had a program where you could initially recycle the aligners, but they rolled it out and I never heard boo about it after they showed me when I did the tour of their Santa Clara office like 4 years ago. They're like, here, this is our new recycling program. I'm like, that's amazing because there's so much plastic waste that goes on. I mean, not only the packaging, but just the old aligners that maybe, you do a refinement and you throw the whole box away. Patients are bothered by this. Doctors are bothered by this. I'm certainly bothered by this. So the workaround that we do is we set up the case. We say just to do tipping on top, but we never deliver the top aligners. We go into each bag, pull them out. They get their expander or their crib, you know, so their top is going to change because they need some type of functional appliance on the top, be it a crib or an expander, fixed or removable. And we throw away the top aligners and we just deliver the lower. And you know, they go through that first round. Obviously, you're going to do an unlimited case, a comprehensive unlimited case. And then once they finish their, you know, 4 to 6 months with the expander and retention period of the expander, you're going to go ahead and rescan, capture top and bottom together. I recommend that you let the top settle a little bit first. Let the bite settle on top because you can get some really funky interferences and it might make the case go way, way longer than it needs to. So I like to make sure we have nice, even contacts on both sides before I do the rescan after the retention period. In the expander or after 6 to 9 months in the crib. Of course, I recommend OMT. OMT is way, way, way better for habits because then you can do it the same time as the Invisalign, right? And there's no waste. So anyways, but that's my workaround. Invisalign, if you don't like it, come up with another way so that we can do this. Roll out your products that I know are in the funnel, they're in the pipeline, so that we can start using them, so we can stop wasting plastic and resources. I would really, really, really like that. But right now, that's the workaround. Thank goodness for the 5 years because you can get started. The patient gets their Invisalign on bottom, and on top, you can do your functional appliance. All right, thanks so much.